It's Monday, March 29. This is the news on PBCJ. I'm Simone Absalom Gale. On Monday morning, Prime Minister Andrew Holness joined the Secretary General of the United Nations, Antonio Guterres, and the Canadian Prime Minister Justin Trudeau for the United Nations High-Level Financing for Development meeting on debt and liquidity.
We are already in the worst global recession in 90 years. We cannot walk head-on, eyes wide open, into a debt crisis that is foreseeable and preventable. Many developing countries face financing constraints that mean they cannot invest in recovery and resilience, nor can they access the vaccines that provide the fastest route out of the pandemic. A global vaccination gap threatens everyone in developing and advanced economies alike. Developing countries urgently need access to additional liquidity to respond to the pandemic and to invest in a sustainable and inclusive recovery.
We're saying that our world was at a crossroads because what was clear then and what has only become clearer in the months since is that this pandemic has laid bare gaps and inequalities in our economies and our societies. The global economy has now seen its worst recession in 90 years. Tens of millions of people have fallen back into extreme poverty, and hundreds of millions more are likely to fall even deeper into hunger. Add to this the crisis of climate change, which only exacerbates economic challenges, especially for small island economies like our friends in the Caribbean, and we are facing a true watershed moment.
At the forefront of the challenges we face are those related to debt sustainability and the need for increased liquidity. The elevated debt risk that confront developing countries, particularly those that were already grappling with high debt burdens, require urgent action by the international community. We therefore welcome the efforts made by the G20 to establish the Debt Service Suspension Initiative, the DSSI, which has been extended through June 2021. However, we urge that it be further extended to at least the end of this year and ideally to the end of 2022.
More than 600 persons over 75 years old received the first dose of the COVID-19 vaccine manufactured by the AstraZeneca at the National Arena in Kingston on Saturday. In a release, the Health and Wellness Ministry said that this represents 92% of the persons registered to be inoculated at the site. Among the persons vaccinated were 4 centenarians, including a 102-year-old woman. Portfolio Minister Dr. Christopher Tufton was pleased with the turnout.
I think it has gone well. We started a little earlier than planned because of the number of persons who came out early. There were persons who were not registered who turned up, but we made some provisions for them. The layout of the location, they allowed for them to come in and to wait a bit until they were brought into the arena where we have 4 clusters. And as you can see, each cluster is administered at the same time, the observation, counseling, vaccination, and then they depart through the exit at the bottom of at the top of the hall. We have had no incidents. The feedback from persons who have benefited have been very positive, so I'm very pleased with that. And I think the team, the health team leading the charge, supported by the JDF and the JCF, have really demonstrated what partnership is about in this national effort. So I am very comfortable with what I have seen.
Persons who have gotten their first jabs of the COVID-19 vaccine must continue to observe all infection prevention and control measures, such as wearing masks, maintaining a physical distance of 6 feet or more, and frequently washing hands with soap and water or use hand sanitizers. The release says the next vaccination blitz operation is planned for Saturday, April 3, 2021 at the National Arena. Approximately 30,000 doses of the coronavirus vaccine have been administered on the island so far. According to the Health and Wellness Minister, Dr. Christopher Tufton, the country is at a halfway mark of the 64,000 doses of the AstraZeneca vaccine. He says the country will continue to use inoculated population as a shipment of 26,000 doses is expected in April. Dr. Tufton spoke to the media after visiting the COVID-19 vaccination process site at the Balaclava Health Center in St. Elizabeth last Thursday. Head of the Caribbean Immunization Technical Advisory Group, Professor Peter Figueroa, has reiterated that COVID-19 vaccine is not associated with an increase in the overall risk of blood clots in those who receive it. Speaking at a recent COVID-19 virtual town hall meeting, he said the benefits of the vaccine in combating the virus outweighs the risk of side effects.
Was a question recently in Europe where there was a concern about blood clots. But I can tell you the majority of persons who develop COVID and have to be admitted to hospital, you have to put them on anticoagulants in order to prevent them from developing blood clots. So when the regulatory organism, the regulatory body, the European Medicine Agency, investigated this problem, they found that overall there were fewer blood clots in persons who had received the vaccine than what they would normally expect in the population, because people developing clots happens all the time. But they actually found overall there was fewer blood clot formation in those who were vaccinated. However, nevertheless, they said we have to be alert. So they say, let's put out a warning to the physicians and put it in the pamphlet to persons being vaccinated. They could not rule out a risk that there may be blood clots, so let's be alert for it. But that potential risk is approximately 1 out of 1 million. Whereas if you are elderly, if you're over 60, maybe 1 out of 10, 1 out of 20 is at serious risk of hospitalization. So my word, it's understandable for some people to be hesitant. I say let's vaccinate those who are ready, and as we vaccinate more persons, others will see that the vaccine is safe.
The World Health Organization, WHO, says deliveries of COVID-19 vaccines produced by the Serum Institute of India, SII, to lower-income economies participating in the COVAX facility will face delays during March and April. This as the Indian government shifts its focus to a new wave of COVID-19 infections in that country. According to the WHO, its team is also facing delays in the delivery of COVID-19 vaccines as some rich countries continue to monopolize the sale and stock up on vaccines. Jamaica is a signatory of the COVAX facility. Here's an update on the situation from a recent WHO virtual press brief. The Serum Institute is contracted to provide a COVAX with manufactured AstraZeneca Oxford vaccine to 64 lower-income economies participating in the COVAX facility. The WHO was expecting an additional 40 million doses to be available in March and up to 50 million doses in April. Director General of the WHO, Dr. Tedros Ghebreyesus, says vaccine hoarding is still a major problem.
And too many health workers and priority groups are still waiting to be vaccinated in too many places. As we speak, 36 countries want to start but do not have access to vaccines yet. And as Minister said, of the 536 million vaccine doses administered so far, 76% have gone to only 10 countries, most of them, of course, high-income countries.
Meanwhile, the Director General has announced that the WHO received the report on SARS-CoV-2 virus origins from its team, which was sent to Wuhan, China, the Chinese province where the novel coronavirus was first confirmed.
The report, of course, was sent under embargo. It's not public yet. Under embargo to member states based on their request. because we will have a mission briefing tomorrow with member states. And of course, after the briefing to the member states, it will be public. It will be on WHO's website. All hypotheses are on the table and warrant complete and further studies from what I have seen so far. Of course, I will have more to say following further review and understanding of the report, but for now, all hypotheses will be on the table and will need further study.
The security forces have been given more legal resources to carry out their role in the management of the COVID-19 pandemic. This as the Disaster Risk Management Amendment Act 2021 was approved in the Senate on Friday, March 26. The Disaster Risk Management Amendment Act 2021 seeks to amend the Disaster Risk Management Act to introduce a specific enforceable system of sanctions against persons who breach the public health protocols. Leader of opposition business, Peter Bunting, said he was against rushing through the amendments as there were concerns about some of the proposed changes to the act. He was one of several members of the opposition who voiced their concerns.
Mr. President, I think it is very unwise and unnecessary, because even if it were to pass this evening, it could not come into effect. It has to go back to the lower house. So why are we making this bill, which is of serious concern?
I don't believe a delay, which would give us chance to quickly assemble a joint select committee as promised by the Prime Minister, to have the input of the citizens of the country in this bill. At least one of our presenters, who was due to contribute significantly from our side, had to leave because of circumstances beyond our control.
Whereas there is a general acceptance that there is need for stronger measures to ensure that persons are compliant, there is, in my opinion, and based on my reading on social media and other places, that there is almost a national questioning of this bill. There are, and I don't want to, so I'm going to be very careful in, walking on that line, but there are, in fact, provisions that have left people, perhaps I'd say, very concerned.
Leader of government business in the Senate, Kamina Johnson-Smith, who piloted the bill, said this system of sanctions is one that is much needed.
On the 19th, that is the Friday, the following day, it was circulated to all senators. On the back of that email on the same day, I wrote to all senators and encouraged senators, reminded them that we would be sitting on the 26th to take the appropriations bill, and I was asking that they sensitize themselves to the DRMA bill, which had just been circulated, and so that they could raise any concerns and they could be considered in a way which would allow for their prompt taking. That I was at that time, because it was Friday, still awaiting guidance on the actual timing of the passage of the act, but that I am placing it on their radar.
The bill was passed in the lower house on Tuesday, March 23. According to Senator Johnson-Smith, then the leader of the opposition, Mark Golding, had said a joint select committee was not needed to consider the bill, so it was put through all its stages in the other house.
The fact that that was agreed in recognition of the urgency of the matter. The reality is that people are dying. People are dying. The hospitals are full. The opposition, the government, The government has been criticized. The government... The government... Talk to your leader. Talk to your leader. The government has been criticized for not being strong enough on enforcement. Even the opposition responded to the measures announced on Sunday by saying that they didn't go far enough.
After much debate, the Disaster Risk Management Amendment Act 2021 was passed in the Senate with 3 amendments. The pilot of the government's e-commerce national delivery solution went live in Portmore on the weekend. Minister without portfolio in the Ministry of National Security, Matthew Samuda, says the launch was successful despite some challenges. He is cautioning that residents should not attempt to go out to businesses registered under the Pilot Ends program during curfew, but allow it to work as designed. The Ends program allows entrepreneurs with quick service businesses to apply and continue to work beyond curfew. Minister Samuda says plans are being implemented to expand the Ends program to other parishes. Condolences are still being voiced for prominent physician Dr. Jephthah Ford, who died on Sunday morning. Culture Minister Olivia Grange, in a statement, expressed deep sadness at Dr. Ford's passing. President of the People's National Party, Mark Golding, described him as, quote, a champion for social justice and a community physician par excellence, end quote. The late physician featured in several high-profile cases. One of the most recent was that of Jody and Farron, who died shortly after giving birth in 2020. We now get the latest market updates in this quick business report from Carol Francis.
Thanks for joining us for the Business Report. I'm Carol Francis in for Gabriel Thompson. In Friday's trading session, the JSE All Jamaican Composite Index advanced by 2,733 points to close at 433,426 points. The Junior Market Index advanced by 12.51 points to close at almost 3,000 points. Overall market activity resulted from trading in 46 stocks, of which 20 advanced, 14 declined, and 12 traded firm. Trans-Jamaican Highway Limited was the volume leader with 2.5 million units. They were followed by Sagicor Select Funds Limited Financial with 1.3 million units and the Wigton Wind Farm Limited Ordinary Shares with 1.32 million units. The US dollar on Friday, March 26, closed the trading day at $146.19, down 33 cents. The Canadian dollar ended trading at $117.05, down from $117.68. The British pound sterling ended trading at $202.42, up from $201.22. The euro traded at an average of $174.09. Oil prices rose slightly on Monday as world shares started the week on cautious ground as uncertainty over the fallout of the default of a U.S. hedge fund tempered relief from the refloating of the ship blocking the Suez Canal. Brent crude oil futures gained 67 cents to sell for $65.10 a barrel. West Texas Intermediate crude oil futures is up by 48 cents for $61.45 a barrel. And that's the Business Report. I'm Carol Francis in for Gabriel Thompson.
Here are the stories making the news across the region. Over 63,000 Bajans were vaccinated in phase 1 of the country's vaccination program. We get more in this report from Barbados today.
The first phase of the first dose of Barbados's national vaccination program for COVID-19 has ended, with 63,689 people being vaccinated. Of the total number of those inoculated, 26,325 are men and 37,364 are women. Co-coordinator of the vaccination program, Major David Clark, tells Barbados Today officials have learned from the experiences of the first phase and will be better able to manage administering the second dose of the Oxford AstraZeneca vaccine, which begins from Saturday, April 17th.
We will be able to manage that better because we now have everybody's details in the SHAPE app. So people will be able to get an email telling them when they're supposed to come. So we won't have the same issues that we had with people showing up, because it could only come if you get your confirmation to come to your second dose. And also we'll be able to manage it in a much better way in terms of the numbers of people coming and to the locations. So certainly the exercise that we went through by collecting all the data, we don't have to go through that again, as we've done that already. So I think going forward, we have learned from the experiences of this first phase, and so certainly we will take all the lessons learned and incorporate them into the other phases going forward.
Major Clark is urging members of the public, even those who have received their first dose of the Oxford AstraZeneca vaccine, to adhere to the health protocols.
People need to adhere to the protocols that have been established. Because you may be vaccinated does not mean you shouldn't adhere to the protocols. So we still need to adhere. We've only vaccinated just over 63,000 people. We still have a long way to go as we're waiting for the supply of vaccines to come. So I think people should still be cognizant and adhere to the protocols that have been established.
Meantime, 7 men and 13 women tested positive for COVID-19 last Saturday, taking the number of total recorded cases in the country to 3,629. That's a breakdown of 1,745 females and 1,884 males. Additionally, 14 people recovered from the viral illness and were discharged. There are currently 160 people in isolation. 3,436 people have recovered from the virus and 41 have died.
The Bahamas is seeing an increase in visitors to their shores. OUR News' Jasmine Brown is tracking reactions from key stakeholders in the tourism industry.
The once bustling tourism sector is now a shell of its former self thanks to the global COVID-19 pandemic that essentially pumped the brakes on the industry. But as the world continues to cope with the pandemic and vaccines are being distributed and administered across the world, the global tourism industry is beginning to see a bump in travelers. Tourism Minister Dionisio de Aguilar says it's been a slow and steady process.
So what we're noticing, and the best way to gauge it, is to look at the number of applications on the Bahamas Health Visa. And every month we're seeing an increase. And certainly now in March and April, based on the numbers that we're seeing passing through that, and also based on the numbers that the hotels are reporting to us. As we've always said, we expect the numbers to slowly increase through this year. And as more and more people get vaccinated in the United States, you see they're doing it at a phenomenal rate right now. They got lots of vaccines. People are getting vaccinated at a phenomenal rate. And studies have shown when people get vaccinated, they want to travel.
According to stats from the Ministry of Tourism, the Bahamas is seeing a similar trend. They revealed that over 100,000 people have applied to the Ministry of Tourism for travel health visas to enter the Bahamas over the last 4 months. That's good news from where those numbers stood for much of 2019. For example, total visitor arrivals from December 2020 dropped by 95% year over year, despite the reopening of 2 major resort destinations and other major hotels. That month, the Ministry of Tourism only approved 35,000 health travel visas. Those 35,000 stand in stark contrast to the 710,000 plus visitors that the Ministry of Tourism statistics show visited the Bahamas in December 2019. No one felt those dismal numbers more than frontline tourism workers like taxi drivers. Last December, this taxi driver who was stationed at Bahamar told us just how tough times were back then.
The situation is getting worse than getting better because, imagine being out there a whole week and you haven't collected a fare up to today, and this is from March.
But in just a few short months, Bahamas Taxi Cab Drivers Union President Wesley Ferguson says things are getting better, with more visitors deciding to vacation in the Bahamas. He told our news team that the spring break visitors this month have been a welcomed boost to business.
It's exciting news in the taxi industry, and not to say that we are back to normalcy, but however, with the new arrivals of, I think the spring breakers have now added to the amount of tourists that are visiting our shores. And of course, taxi drivers are taking advantage of the increased amount of tourists that are, coming back to the Bahamas. And we're excited because, we crave the day when we could get back to the old days, when it was normal, where you don't have to have all the protocols in place, the mask, the sanitizing and all that other stuff. But yeah, we are the industry is slowly creeping back to some normalcy. When I look at the numbers that are sent to my phone by NAD every day, it seems as if we have increase of about just thereabouts about 1,000 people a day or more. Just over 1,000 people a day. Whereas, in contrast to what was.
Reporting for our news, I'm Jasmine Brown.
In sports, we put the spotlight on cricket. Jamaican batsman Nkrumah says it is a special feeling to finally get a Test 100. After making 86 and 90 in his debut series against Bangladesh earlier this year, the right-hander made a brilliant 113 to lead West Indies to a hard-fought draw in the first Test against Sri Lanka last week. He spoke with Newsroom Guyana.
When you walked to the crease this morning, what was your plan?
Obviously, the team had a game plan, from the even before we had a discussion, and basically, the coach and the team, said that, we wanted to bat for ourselves, for most, and bat for our families, and the people who support West Indies cricket.
Was there any point in time where you felt like we should go after the runs?
No, I would say no. I think, the outfield is thick, his experience. Bowling attack also, and the ball was a little bit soft. So, at first, in the beginning we had a small hope, but then lunchtime we decided no.
Today, you achieve your maiden Test century. Tell us what that feeling is like. You seem very emotional when you hit that 4.
It's very emotional, and I don't think it's something I can explain. I think it's something that, someone have to experience, but all I can say, it's a really, really special feeling.
Did Jason Holder offer you any words of advice when you were in those nervy 90s?
Yeah, obviously when I was 99, I thought the rain was coming, and I wanted to get the 100. I didn't want to stay 99 not out. So, Jason came down and said, just stay calm, stick to your process, and stick to your game plan, and it will happen, and it is thankful.
Your top score seems to be improving match by match. What is the secret to this constant improvement by Nkrumah?
Well, I wouldn't say there is no secret. Obviously, I have to say thank you to the batting coach, obviously. He did a lot of work with me during innings, and, I'm happy to see that paid off.
How much are you looking forward to continuing your form in the second and final test?
Well, it's a crucial test for us. We managed to draw this test match. Obviously, there is a few areas that we need to top up on. So obviously, we want to do it over the next 3 days, and be ready as possible for the next test match.
And that's the news. Thanks so much for making it PBCJ. Remember, we are the people's station. Stay safe.